Good evening and welcome to the UP Community Health Town Hall program. Tonight's program is going to focus on behavioral health and an update on regional projects that are happening throughout the Upper Peninsula of Michigan. Tonight's program is hosted by the Center for Rural Health at Northern Michigan University. My name is Elise Burr and I'm the director. Tonight's program has been organized in partnership with Dr. Kelly Kam, epidemiologist and assistant professor in the Department of Kinesiology and Integrative Physiology at Michigan Technological University. Kelly, unfortunately, is unable to join us tonight, so she has actually shared a number of statistics with me that I'm going to share with you now about mental health. Mental health is something that actually changes over time. It depends on the demands that we have and the stressors in life and acute situations that happen. We have some expert panelists who will be joining us tonight on the program. I'd like to introduce them and have them go ahead and log in. We have Christy Hechtman. She's the Quality Initiative Coordinator of Behavioral Health Integration at UP Healthcare Solutions. Welcome, Christy.
Thank you.
We have Greg Nean, Superintendent of Marquette Elger Regional Educational Service Agency, otherwise known as MARISA. Welcome, Greg.
Thank you, Elise.
Darren Kinnunen is a principal at Horizons Alternative High School up in Mohawk. Hi, Darren.
Hello, thanks, Elise, for having me.
Yep. And lastly, we have Jim LaJoy, Executive Director of Superior Health Foundation. And he's going to be talking a little bit tonight about some upcoming funding opportunities for behavioral health. Welcome, Jim.
Thank you, Elise. Glad to be here.
So a few statistics that Kelly asked me to share with everybody. Mental health in children, we'll start with that. It's important to learn healthy social skills and how to cope at a young age because this will last a long time in their life and have a lifelong impact. There was a school health policy and practices survey that was conducted in 2016. And some of the statistics that were shared from that are as of 2014, it looks like schools with required instruction on suicide prevention. Just to share a couple of those statistics. At the time, 20.4 elementary schools required that instruction on suicide prevention. 47.9% middle schools and 73.7% high schools. The required instruction on emotional and mental health for elementary students, it was 52.3%. Middle schools was about 67%, and high schools were about 83%. Also, the staff for mental health in schools. At the time, 78% of schools had a school counselor, 56 had a school psychologist, and 45% of schools had a social worker. Also at the time, 12% of schools had a policy to screen students for mental health problems. Not very significant when you think of 12% of the population, of our youth. For working adults, we talk about poor working conditions, risks to mental health based on that. Some of the conditions can include anything from discrimination to inequality, excessive workloads, low job control, job insecurity. So it's really important for employers to think about the safe and healthy working conditions for their staff. There was a report that was released this year from the Surgeon General on loneliness and isolation. And some of the information from that was pretty interesting. Social disconnectedness increased the risk of health conditions such as cardiovascular disease, dementia, stroke, depression, anxiety, self-harm, premature death, and even infectious diseases because of the impact that the depression really had on the immune system. The risk of premature mortality due to lack of social connection is similar to smoking, approximately 15 cigarettes a day. So who knew that isolation could really have that kind of an impact? About half of the US adults report experiencing loneliness, and the rate is higher in younger adults compared to older adults. Only 16% of adults reported feeling very attached to their local community. That's pretty low when you think about who exists right now in our communities. Community infrastructure can really help support social connections, everything from physical assets to programs, transportation, housing. Seems like a lot of what we talk about goes back to the conditions that we have, our physical conditions in our environment. So to no surprise, behavioral health is right along those same lines. The social connected communities have better community safety, resilience, prosperity, and the government is more representative of population health and well-being when it comes to healthier communities. So how can we improve connection at the society level? We can build better environments to support connection, programs, and policies to bring people together, and have an overall culture of kindness, respect, service, and commitment to each other to build a better society. So we're going to get started with having some of our panelists talk. Christy is going to start off the program. And Christy, if you want to tell us a little bit about UP Healthcare Solutions efforts right now in investigating challenges and providing and receiving behavioral health care services in the region.
Absolutely, thank you. Yeah, they've been kind of on the rise of this epidemic related to mental health for quite a number of years now. A lot of the work began with an Uplift grant that we received, which was a 3-year grant from HRSA, and that allowed us to integrate behavioral health services to 2 of our partner clinics, which was Helen Newberry Joy and Schoolcraft Memorial Hospital. So we were able to offer training and support in bringing on this new model. And you were able to actually integrate some consulting psychiatry with this model as well. So collaborative care allows for consulting on patients that most often have mild to moderate mental health concerns, but what we've seen due to the shortage across the Upper Peninsula, much more advanced mental health status was coming our way with this project. But another component of integrating mental health was the ECHO program that we were able to also launch. And this is an incredible model that is not only nationwide, but across the entire world, and that utilizes specialists and subject matter experts to train our primary care providers on additional ways in which they can diagnose and treat these disorders. So this allows them to get free CME and CEUs for not only the providers, but their staff. And we were quite successful with that and had a lot of great feedback from our providers. So with that project, we then wrote another grant and were awarded a 2-year project for just strictly echo in the behavioral health realm. And that allows us to move knowledge instead of patients, and especially in the rural areas up here, is quite important. So this is from the Michigan Health Endowment Fund, and we had 4 separate programs, and we're on our 3rd of those 4. So the first one was integrating pediatric mental health into primary care. The second cohort was medication-assisted treatments and therapy for substance and opioid use. And we're currently in the series with trauma-informed care. So we have one left later this year that we're serving providers and those that treat patients of this population to offer topics that are most relevant in their communities. And then finally, with the Behavioral Health ECHO grant, we also set up a behavioral health committee. And that was started last April, where we hosted a behavioral health summit across the entire Upper Peninsula. And that had, some of our payers and our community mental health agencies, our psychiatrists, psychologists, social workers, and just those leading the way in mental health and speaking firsthand on what issues were needed by county and across the board. So through that, we identified many barriers and hurdles, as well as things that we do well. And through the committee, we've been able to continue this work and really focus on expanding services and unifying the Upper Peninsula with yet another grant that we should know in the next couple months if we'll be awarded. And that would set a standard of care across the Upper Peninsula, allowing any patient of any age, insurance mix, or rural, location to have access. And through improving access, we hope to also bring in more specialists and psychiatrists. Our nurse practitioners do phenomenal work in our areas, and build upon that a hub and spoke model potentially, as well as a registry across the Upper Peninsula for not only patients, but services.
Christy, I have a quick question for you. You talked about that ECHO program.
Yeah.
Can any provider in the Upper Peninsula engage in that program or learn more about it? How would they do that?
They can absolutely register. The program is ideally for primary care providers so that they can, as frontline treaters, of our patient populations, they're first to identify these needs and could absolutely join any of these programs. So they would just go to info@uphcs.org and you'll be connected with our team, and we can get you the curriculum, registration information, and we also are able to do case presentations so that the subject matter experts are also consulting on real patients within our communities and getting information on how to better treat them and what should happen next.
And can you also explain a little bit, Christy? I know those of us in the industry understand hub and spoke, but for listeners who may not be familiar with that kind of model, can you talk about that a little bit? Who's the hub, who's the spoke, what it's all connecting to?
Yes, so this is the best practices, evidence-based model that UP Healthcare Solutions has partnered with Dr. Mahar. She's a psychiatrist in the Upper Peninsula. So she's helping us build a plan, and a lot of it does hinder on whether or not we get this grant, but it's a planning grant. So simultaneously, whether or not we have this funding, we already have buy-in from the health systems across the Upper Peninsula, and we're looking to collaborate with other agencies, which has already begun because many of them are on our behavioral health committee as well. But yes, it would be sort of a master location, having the psychiatrists and neuropsychologists, our nurse practitioners, and it allows for education and a standardization of care. We're hoping to have the psychiatric residency do rotations through here, and so they would learn as well, how to better treat the rural populations, and hopefully stay for a few years to expand services. And it would just sort of be a rotating model that would improve services and access regardless of patient's location. If it's pediatric or geriatric, everyone should be able to receive access in theory. And so that's what we're working toward, along with our partner agencies, that some of which are on the call today.
And when do you, I'm sorry if I'm making you repeat yourself, but when do you hear about that grant?
We will know in the next couple weeks.
Okay.
And but again, even if it's not something that we are awarded, we continue to work as a community with the other agencies to, and mainly healthcare systems as well, to buy into that,
Great.
to improve services for their patients as well.
Yeah, it's much needed work. And, we're fortunate to have UP Healthcare Solutions, to have that access to our healthcare entities in the Upper Peninsula, just because of the volume of patients being served and to get that buy-in in the region. So,
And we're seeing a lot of the health systems are interested because they are having to write off so many of the services in mental health and behavioral health and substance use. So this is an opportunity instead to invest those funds instead of doing write-offs and improve upon these services in the Upper Peninsula.
yeah, that's great. Great. Well, thank you, Christy. Appreciate the update, and, look forward to seeing how this comes, to fruition over the next several months. Much needed services. So thank you, for everything that you and UP Healthcare Solutions is doing.
Thank you for having us.
And for our listeners who are just now joining us, this is the UP Community Health Town Hall program. And tonight's program is focusing on updates about behavioral health projects that are happening throughout our region. Our next guest is Greg Nean, superintendent at Marisa. And Greg has had a lot of work going on. He's been extremely busy. I should say a number of us have run into each other multiple times this week because of activity. Thanks for joining us, Greg. Please feel free to share some updates with us.
Well, thank you, Elise. It's my pleasure to be here. And I'm in good company tonight, so a lot of familiar faces. So last year, Marquette Alger RISA completed its new and improved strategic plan. One of the priorities for our agency was focusing on mental health supports for the region. So over the past couple of years, of course, as we've come out of the pandemic, there's been a lot of focus and a lot of conversation around the mental health and well-being, not only of our students, but also of our staff members. The Michigan Education Association, also known as the MEA, is the teachers union for this state, of course. And in 2022, the MEA had a statewide survey, and one of the interesting points that came out of that survey was the fact that 88% of educators reported being concerned or highly concerned about student behavioral issues and mental health. So that was right kind of on the heels of the pandemic coming to an end, about the same time that the Surgeon General talked about something that he referred to as devastating a mental health crisis. He really referred to it, put it into the context of a national emergency and a severe shortage of therapists and treatment providers, as we have all realized in this region and across the state. Now, this also coincided with a pretty significant increase in suicide rates for people between the ages of 10 and 24, which are really our young people. Those are the people that, fall into our age category as K-12 educators, and certainly as recipients of services from intermediate school districts. So within that, as the context or kind of the backdrop, Marquette Alger RISA started a series of community conversations. This really was what I would refer to as a grassroots effort. It was a group of concerned citizens and parents and providers who express their interest in getting involved and trying to be part of improving the mental health and overall well-being of our young people. Unfortunately, this came kind of right on the heels of a couple of tragic losses of life in some of our local school districts. And it really was what I would call kind of a groundswell of interest in our community. We were able to bring those people together for what we referred to as a youth wellness task force. And we began having a series of conversations around how we might improve youth wellness in our region. That conversation has been fruitful over the last year. And a couple of great, I think, products of those conversations that I would point to is the identification of certainly some needs in our region, which, you know, it's not great to point out the fact that we have needs, but identifying those needs and now working to address those needs, I think is the positive piece of my message tonight. And certainly many of the people that I'm sitting here with are a part of that conversation. So Mental Health Navigator, really this kind of falls in line with the no wrong door kind of approach. This is a resource that we would have as a region that would allow people who are in crisis to be able to make one phone call and get connected with the appropriate service provider rather than being at the point of a crisis and trying to figure out or navigate really which provider is going to provide the service that the individual or their loved ones needs. Another great aspect that's come out of these conversations is really what I would call a kind of a cross-agency conversation. So we've unfortunately become accustomed to working in silos. And, you know, education certainly is not immune to that. And so what we've found over the course of the last year is that there are many interested parties who are having parallel conversations, and some individuals are a part of multiple conversations. And so one of the great things that's happened really just this week even is the identification of these parallel conversations, and I think moreover a desire to collapse those silos and to have more of a collective effort rather than multiple individual efforts. And of course we've got a lot more power and authority in when we approach a problem in numbers. So as we look to begin to addressing some of the needs that Christy pointed out, for example, the fact that behavioral health is a loss leader, you know, what can we do collectively to change or to seek change in legislation so that we can modify the way that behavioral health is billed, or so that our healthcare providers, our behavioral health providers are held harmless for some of those costs that they absorb and aren't able to recoup. So those are a couple of the really positive things that have come out. And then I think, you know, as we look forward to what really our agency's vision for mental health would be, is we'd really like to see, at least in our birth to 26 population, again, because that's our focus area, is a well-rounded continuum of services, so that whether you are an individual that falls within that age range and you need mild, moderate, or significant behavioral health supports, we've got those supports in place, and you're not going to experience any sort of gap in services, or, as we often say, kind of fall through those cracks where there are no services. So those are some of the exciting conversations that have really taken root. Again, getting back to our community conversation that's started about a year ago now and going strong. I'll pause there because I just said a lot, and if you have any questions, Elise, otherwise I'll be happy to continue talking.
Yeah, well, Greg, I was hoping, one of the things that was briefly mentioned earlier this week at one of the functions was the concept of having a day treatment facility and what that would look like. Can you explain what that is a little bit?
Sure. Day treatment, first, let me admit that I'm a transplant to Michigan. So I come from central Wisconsin, where as a school administrator and school psychologist of about 23 years in the previous state, I was very familiar with and was able to utilize day treatment programming. And it's really another way of looking at day treatment is a therapeutic classroom. So these are co-located services in which you have behavioral health supports and educators working alongside each other in a setting where students who might typically present as a risk to harm to either themselves or others, or perhaps to the adults that are trying to teach them. This is a setting where they can safely and effectively receive their education and the therapy that they need when they need it. So there's a seamless transition between education and therapy. And the goal of any day treatment program or therapeutic classroom is to help the student generalize and internalize those coping skills that are currently absent in their behavioral presentation and that prevent them from being successful in a traditional school setting. And then once they've generalized those skills, then we begin the process of transitioning them back into their regular school environment. And then, of course, there are all kinds of benefits that come alongside that because the student is now got a new response to what would have previously been a triggering behavior, which allows them to be integrated and to experience a school environment just as their typically functioning peers do. So that's really the goal of a day treatment program. And we do have a couple of states around us, Ohio and of course Wisconsin, that have embraced that model. And as some of my colleagues here know, there are some barriers to that when you're a state that hasn't embraced that model. Of course, you've got to figure out the funding, you've got to figure out all of the licensing and the staffing components. But I think Christy mentioned the Michigan Health Endowment Fund earlier, and our agency is partnering with Great Lakes Recovery Center, and we have put forward a grant to hopefully get a pilot program started here in the Marquette area. And we believe that if we can get that program up and running and collect some efficacy data, present that to the state, it should really be a slam dunk for the state to grab that and scale it up for the rest of the students in Michigan.
I think that's great. I mean, there's a lot of people doing a lot of efforts, but taking that advocacy to another level and actually getting that type of support is really going to drive some of that programming. And I have to say thank you for clarifying that it's a program and not a facility, because I made the mistake of saying facility. So thank you for correcting me on that.
My pleasure.
Do you have you been able to, I guess given your background, Greg, I would assume that you've been able to really take a look at the gaps right now in the mental health continuum of services for youth? What have you been able to identify as some of those gaps?
Yeah, I think you touched on them early with some of the statistics that you shared. Of course, we're all aware that we've got an educator shortage in the state of Michigan. We also have a shortage of healthcare workers. We have an extreme shortage of mental health providers as well. And there have been really some unintended consequences as the state of Michigan has tried to address mental health in our K-12 settings. And, one of those that I'll point to was the creation of 31N, which is a great program that is designed to address mild and moderate mental health needs in our K-12 settings. But what happened with the advent of 31N is it caused a kind of a statewide migration of mental health providers out of our CMH, our community mental health programs, and into the school settings. And I think, as I look at that logically, you had individuals who were working in crisis or working with individuals who were in crisis on a day-to-day basis. And then they were presented with an opportunity to work with students who had mild and moderate level needs. So there's less vicarious trauma. They were able to move to a schedule that perhaps coincided with their own children or their families. And so, the logic behind those moves, it resonates with me. But what it did is it really left a void in our CMHs. And so now we're left trying to backfill and support and really ramp up the efforts to fill all of those vacant positions that are now so prevalent across the state. And so one of the things that I'm very happy and proud to say is that we're trying to work very closely with our CMH to not only understand the impact and the dynamic between our relationship of our agencies, but also trying to understand kind of the boundaries and services of what each can provide, so that we're trying to be as efficient and effective as partners can be.
Thank you, Greg. That's great. I think it's a lot of information to take in. And I know that you were one of the panelists that was on back in December of 2022. And so, this is a lot of updates since that time, and it's only been 6 months. So, who knows what's going to happen in the next 6 months. We might have another update show coming up, to kind of talk about this a bit. But you've made some amazing progress. And kudos to everybody, because there's a lot of bringing people to the table and identifying who's not at the table, and, really lifting each other up, to support some of the projects that are taking place. And so I think you're doing a great job, and I'm happy to be a part of that. So
yeah,
thanks.
You. It's a team effort.
Yeah. So for listeners just joining us now, this is the UP Community Health Town Hall program, and tonight's discussion is providing an update on some of the behavioral health projects taking place throughout our region. And although that we've so far focused on Marquette, it's time we take it over to the Western Upper Peninsula. And we have Darren Kinnunen, who's principal of Horizons Alternative High School up in Mohawk, where I think you said there's still a little bit of snow on the ground up there, Darren?
Yep, there is. Spring is coming. It's moving slow, but the little bit of snow left. Yeah, so thanks, Elise, for having me on. So for those who don't know, so Mohawk is the home for Horizons Alternative High School. We've been in business now since 2005. We're right in the heart of the Kuna County, so the northernmost high school in Michigan. We're small. We've got 4 teachers and a credit recovery mentor. But to date, I think we've graduated, I think it's 235 seniors. And we've got 11 this year that are going to graduate. And our students really come from all walks of life. We've got 7 local high schools that have students that end up in our program for various reasons. They've got their own story, and for one reason or another, their school journey hasn't been successful. So they come to us looking for something maybe outside the box. So that's a little bit about where we're at. Few years ago. So another thing too to note is Horizons is a part of Calumet Schools. And so we're an umbrella to the Calumet School District. And so a few years ago, Calumet started going through a little bit of a trauma-informed initiative themselves, trying to bring in things like a therapy dog and bringing in professionals to talk to the staff about the effects of stress and what that might look like with kids, and try to bring in like professional development. I don't know if you guys in the Marquette area have heard of Capturing Kids' Hearts, or the local schools have maybe heard some of that, but that's like a professional development focusing on building relationships with children and really developing a culture of safety and trust. And that's what we try to pride ourselves on at Horizons. A lot of those initiatives that we brought to Calumet had already been going on at Horizons. For example, we've had a therapy dog probably, I would say, I was asking the owner of it, and she said that we're probably one of the first schools in Michigan to have a therapy dog. That was before all the rage took on. But on top of that, we've got a student pantry where we've got a local organization. They come in weekly and they stock the pantry full of food and shower necessities and things that kids might use to take home for them with the evening, or maybe make a snack during the day. We don't know what their food situation is at home, so we try to give them access to give them food. Same thing with shower and laundry facilities. Most high schools probably don't have that, but most high schools might not need it. So we try to provide that for our kids, give them access to a private shower, and if they need to do their laundry while they're at school, we give them that option. Just this year, we started running a social emotional group with all these topics that we've heard about so far from the earlier panelists. There's a lot of conversations that aren't happening in school. And I have previous to this position as a principal, I was a social worker. So I was having a lot of these conversations with my students, but I just felt like at the high school level, there's just conversations that weren't happening. So we tried to bring that to the room or to the class this year. We've got a really good working relationship with law enforcement. So up there for us, it'll be Keweenaw County Law Enforcement, Keweenaw County Sheriff's Department. They come in, I would say a few times a month and visit with the kids. It was kind of cool. They came in during Christmas break, or right the last day before Christmas break, and there was about 7 deputies. And during our lunch break, they all got in line and they were playing a game of basketball, playing a game of lightning. So here you have a bunch of kids in an alternative setting playing basketball with a bunch of sheriff deputies. And it was pretty sweet just to see how, out of shape everybody was at the end of that game, but they had this kind of common bond at the end that, it's the holiday season, everyone's there for, everyone's there having fun. So it was a good time. So Keweenaw County Sheriff's Department has been huge for us. We got other things that we try to provide the kids, like a student lounge, maker space, a gaming lab, a school garden, just things that kids might feel connected to. When you think of school, you're thinking of the rigors, you're thinking curriculum, but oftentimes kids just need sometimes just a space to be themselves and kind of, be mindful a little bit and focus on, things that are going on in their life. So we try to provide them spaces and opportunities to connect. And the socialization, I think that term came up earlier tonight already. Socialization is a huge piece. And for our kids, we don't know, again, their journey and their regular schooling. They may have been isolated or felt isolated in that school setting. And so we try to give them an opportunity to kind of connect with each other. Again, they're coming from all different schools, so they don't know each other, at the beginning of the year. So we try to give them opportunities to figure out, who each other are and give an opportunity to make friendships. One of the things we started back in 2018 is we started taking daily stress levels. And that's been probably the biggest game changer for us. At that time, I was the social worker for the school, and the principal then, Joel Esula, had talked to me and said, hey, how do we gauge where our students are at each day? Like we know their names, but we know also that they might be going home or coming from home with some traumatic situations. Like, how do we gauge where our students are at? And so we talked about building these stress numbers where these kids could come in and give us a number from 1 to 10, right? So first thing in the morning and right before they go home, we have this time called mentor time, where it's kind of like an age leveled homeroom, if you would. And so they come in, they got 10 minutes and they talk about where their stress numbers are at, and that gets logged in our form. Then they get an opportunity to talk about what might be driving their number, right? So a kid might come in and say, hey, I'm at a 7 today. I didn't get dinner last night or whatever. I didn't have much to eat. And so now we've got a little bit of information on how we can support that kid, right? That teacher might report, send him down to the pantry to get a quick snack and come back to class. And that stress levels, it's been huge. So if you think about the scale, 1 being low, 10 is max stress. The other nice thing about it is it's kind of a common language, right? I mean, that's something that we as a staff, we're old, we're outdated. We get reminded that we're old school all the time. And the kids are, 20, 30 years younger than we are. And so to try to find a common language or common ground to talk about something is important to stress, right? These guys might not even recognize that they're stressed, but when they have a number and they're used to kind of giving a number every day, it kind of gives us a little better picture of who they're at, where they're at. And what the nice thing too, kind of an unintended kind of a consequence, which has been awesome, is, a kid might say, hey, I'm at a 6, and kind of give a reason. And then the student next to them sitting in the chair, all of a sudden has advice for that student. Hey, when I was in that situation, that stunk, but this is kind of what I did. And so they're kind of mentoring each other, which we didn't anticipate that happening, but that's been like the hugest kind of aha moment for us, is just giving students an opportunity to listen to each other, right? Like, who's a 15-year-old going to listen to more, right? A 42-year-old teacher or another 15-year-old sitting right next to him who maybe has a similar walk of life, right? And so that part has been awesome. And so kind of moving from that social worker into that principal role, we felt it was important, like at the beginning of this year, to kind of talk about for those kids what those numbers might mean to them, right? So if a kid says I'm at a 3, right, like what does that mean? So we really kind of broke down descriptive terms, right? A 3 might mean I'm anxious. Okay, that's great, right? So now we know for this kid, a 3 might mean anxious. So all the kids kind of filled out a little chart that just, again, more information that we have for those students. And on the flip side for them, I told the kids, I said, okay, if I'm at a 10, right? If I hear students at a 10, I'm going to think this kid may have suicidal ideation, right? 10 is going to be max stress, right? At that time, I would say in the last couple of years, we had a lot of kids reporting 10. And then when I would go kind of follow up with them, anytime a kid reports a 10, I immediately go check in with them, because in my brain, I'm thinking suicidal ideation. And then the kid would say, no, it's not that, it's more this. And as we talked it through, the kid would recognize, well, maybe it's more like a 7. But when you think of like an ER visit, right? I thought of one time when I went to the ER, this was probably like 5 years ago. I woke up middle of the night, I had an earache, and it was like painful. It was like the worst pain I ever felt. And so I went to the emergency room, and that was the only thing I could think of. I couldn't think. And there I am in the emergency room, and they're like, where's your pain? I'm like, I'm at a 10, right? And the nurse kind of laughed at me like, you're at a 10, right? 2 hours earlier, there was probably a car crash where someone came in and broke their femur. That's an actual 10, right? Here I am with an earache, right? For me, it felt like a 10. But then when you kind of step back and say, okay, well, on the broad spectrum of things, where really is an earache, right? So for me, it probably was a 7. Well, it's kind of similar for the kids, right? Just kind of that common language. A 10 to me meaning suicidal ideation. And we've been fortunate enough that we didn't have any 10s this year. And I say fortunate because, kids didn't feel they were at that point. And were they before? Are they completely honest? We never know. We try to trust that the kids are being honest. The numbers do seem to fluctuate at times of high stress. So when we go into spring break, for example, when kids may be left to their own devices at home, or maybe in survival mode, those numbers do elevate for periods of long breaks. And then when they come back to school, the numbers do come down. So we do think that the kids are, that they're being honest. I used a little metaphor with them this fall. I'm a sucker for Taco Bell. And so when I was there this summer, I grabbed a whole bunch of Taco Bell packets, all these sauces, right? And so I gave the kids an analogy at the beginning of the year. I held up, they have a breakfast salsa packet. And I said, well, if I was talking about stress in Taco Bell terms, this salsa packet would be like a 2 or 3 on the stress level. And then I grabbed a mild packet, and I said, okay, at a mild, I'd probably be at like a 4 or 5 with stress, right? And the kids could kind of see where it's going, right? And so a 6 and 7 would be your hot sauce packet. The 8 and 9 is the fire sauce, and the 10, that's the Diablo, right? That's when things are maxed out. And the kids thought it was corny at first, but they all laughed. So I think that they kind of got the gist of it. But again, it was just another kind of common dialogue for our students, which I think is huge. And we started to make, yeah, go ahead, Elise.
I wanted to just ask you, so when you first started implementing this, were kids receptive? Did they just, oh, okay, and just report out their number. Was there a little apprehension? I mean, it sounds like it's going great now, but how did that roll out initially?
Yeah, absolutely. It's a great question. And so I would say right off the bat, no, the kids were not receptive, right? We really had to be intentional with our conversations with them about why we are doing it, right? And so once we were able to establish that, hey, all of us have stress. The teachers report their stress numbers. The kids know that the teachers have it. And once they kind of figure out why we have it, right? Like we all have stress. And there are some things that we provide in our school, the pantry, the lounge, all these things. Mm-hmm. These were designed as a response to your stress numbers. So the more we can figure out what needs of our students are, the more likely we're able to continue and provide more resources. So once we kind of got the kids on board and they understood it, right? Because they may have been let down by the adults in their life prior, right? Maybe, maybe in the schooling or maybe some of the loved ones that they had weren't always there for them. I don't know, right? It's their own journey. So they're going to be slow to trust us, and we would want them to be that way, right? We would expect them to be that way. But to answer your question, yeah, I would say the kids were, they were definitely kind of almost with anything, right? They're just apprehensive, just want to make sure, why are you asking this information? I'm in high school. I'm supposed to be learning. This is nothing that I've ever been taught in school, right?
And I think that's great advice for somebody who's at a school that might want to try something like this that hasn't done it, to know just because it doesn't work initially doesn't mean it can't get there.
Yeah, absolutely. Yep, for sure.
So that's great. Fortunate for the kids, I guess, for you to have that social work background too.
Yeah, we joke about it. We say it's an experiment. Can a social worker be a principal? So far, it's working. But the kids never miss an opportunity to poke fun where they can. They say things like, "You're not a real principal. You're still a social worker." But yeah, we've got pretty good dialogue.
No, kids will be kids, right?
Absolutely.
Well, and my hope is that people will listen to this show, whether they're listening live or watching the recording, to know that I think there's a lot of Mohawks throughout the Upper Peninsula, right? So I love sharing the stories of what's happening in all parts of the UP and the smaller towns, especially because there's a lot of people that can identify with what's happening.
Absolutely.
So I really appreciate you being on the show, Darren, and being able to share your story with us.
Yeah, for sure. My pleasure. Thanks again for inviting me to come tonight.
Yeah, we really appreciate it. For people just joining us, this is the UP Community Health Town Hall Show, and we are getting an update tonight on projects that are happening throughout the Upper Peninsula. We had a few different meetings that took place earlier this week in the Marquette area about behavioral health and youth mental health. And we're fortunate enough to have Jim LaJoy on tonight. He's the Executive Director of Superior Health Foundation. And he's going to talk a little bit about, well, Jim, he could talk about a lot of things, but he's going to focus on kind of what's happened over the years, what he's seen in behavioral health from that funding standpoint, and about an upcoming opportunity that he'd like to share with people throughout the UP as well. So thank you, Jim.
Yeah, absolutely. Happy to be part of it. And Darren, what you're doing up there is awesome. That's just incredible. So kudos to you and all the work that you're doing. So one of the things that we're doing is, we've dedicated over the next 2 years a little more than $1.1 million in funding to address pediatric mental health issues in the UP. And we know the significance of this. We see it. We see the statistics all across Michigan, all across, the United States, and our children are hurting. So we had a roundtable. We held a roundtable on Tuesday. We had 50 people, about 50 people in person, and another 20 that joined us via Zoom. And we had just an incredible, robust discussion about what are the issues, what's happening, what are some of the things that are happening across the UP that can have a direct impact, whether it's on the preventive side, whether it's on the treatment side, and the ISD side. And we had some just incredible discussions over a 6-hour period. And, we're going through that information as we speak. I just looked at all the information today, and it was just, it was incredible to see the amount of feedback, the amount of positive reinforcement that we need to do something in this arena. Because we know our kids are hurting. We know that we need to do something. We need to act in a positive, constructive way, in a collaborative way. And to that end, we're dedicating, like I said, a good amount of money to this, but we have some funding support from the Michigan Health Endowment Fund. I just got off the phone earlier today with Blue Cross Blue Shield of Michigan Foundation, and they're going to be committing some funding to this as well. So we have some pretty good funding that will go a long way to address, these issues. And we know they're complicated. And I was fortunate to be in a number of groups for our roundtable to talk about what's happening in our schools, what kids are going through, what are some of the outlying issues. And there's a lot there. And I think we can all agree that it's going to take a collaborative effort. It's going to take a number of different people and organizations working together to, put a definitive impact on this. And we feel that strongly that, our kids are our future. They are. And when you look at kids and where they're at and the types of things that they're going through with depression, anxiety, suicidal thoughts, it's scary. I'll give you a little anecdotal story to share. So today I was over at the Y. I was working on at the Y, and I particularly like to go to the Y because it's a good workout. But I like to go there because when I go, I have a seat that's right by the window where all the young kids are out there playing. And they're innocent. These are 3, 4, 5, 6-year-old kids that are out there running around and being innocent and just being part of nature and just not knowing, just being fun, just being a kid. And I look at that and I say, this is our future. And these kids grow into, grade school, they grow into junior high, and then they're influenced by social media, and they're influenced by all these different factors. And then you throw the family dynamic into it. And just watching these kids just always gives me a perspective about what could it be? Where could we be if we had adequate funding to help these children and provide a resource across the Upper Peninsula? And I think when we had the session on Tuesday, there was so many good discussions from the provider perspective, from the ISD perspective, from the perspective of a number of different practitioners that are working in this field. They're experts and we're learning from them. We're a funder. And I think from that, we got a real good sense that we got some concrete ideas here that could really play an instrumental role in solutions and how we're going to attack this and how we're going to look at it. We know we can't fix the problem. I think we're all in agreement with that. I mean, the problem is huge, but can we incrementally have a role in solving some of this? Absolutely. And I think listening to the folks before me, it's encouraging to see that there are a lot of good networks and there are a lot of good people that are working tirelessly behind the scenes, knowing that if we don't do something about mental health for our children, we are in a bad space. And we're going to do the best that we possibly can to provide those solutions and help solve these issues.
I was thinking, Jim, when you were talking about it, I mean, mental health it's a big deal, and it's a big issue, and there isn't always just one thing that's going to fix a big issue. But when I take a look at the roundtables that you've had over the last 6 years, everything that you've had a roundtable about ultimately impacts health, and everything is intertwined. That food security, the transportation. I mean, these are all barriers to care and barriers to health, and it impacts everybody in our rural area. I mean, that's just the nature of being in rural. And I wondered if you could talk for a couple minutes about the importance of collaboration.
Oh,
And that's something that you really talk about when it comes to funding and how to get people together. And I just wondered if you could talk about that for a minute.
absolutely. I'd be happy to, Elise. Thank you for that opportunity. Yeah, collaboration is key. And, we live in an area that is very rural. We're diverse. We have 15 counties. And what necessarily is working in Dickinson County may not be working in Mackinac County. What's working in Houghton County may not be successful in Delta. So what we've learned over the years is that if you have like-minded partners that are willing to get together and work on solutions to these issues, they work really well. And that's part of the reason we do the roundtable. We do the roundtable for several reasons. Number one is to draw people together, provide them education, provide them an opportunity to meet with like-minded people that are working on similar issues. But at the end of the day, we want to see people in organizations kind of like exchange their business cards at the end of the day and have those discussions about, this is pretty cool. Here's what we could do. And we saw that. We saw that at the end of the day on Tuesday. I stuck around until, the roundtable ended like shortly after 4:00, but I was there till like 4:45, and I saw a number of organizations exchanging business cards, talking to one another, and talking about how they could play a role in working together on like-minded proposals that could come to us that would make a measurable difference. And that's what we need. We need collaboration. And that's why this whole topic area and what we're talking about today, I heard the word collaboration so many times, and it's beautiful. It's beautiful. That's how you get things done in the Upper Peninsula. It's working together, talking to people and sharing stories and figuring out how are we going to get from point A to point B with the money that we have. And fortunately, we're in a spot that we have a number of organizations that love the work that we do. And we have such a great relationship with the ISDs all across the UP and other healthcare providers. Let's work together on this, and let's find ways that we can collaborate and come to some solutions to help, our children, because they are our future.
The other thing I think is important to know for anybody who's considering applying for your funding opportunity is that as you receive, whether it's letters of intent or have conversations with people, I feel as though your foundation is very good about connecting people. You might have a similar thing submitted from 2 or 3 different groups, then you actually help to put them together in touch with each other, and by doing so, you really leverage that power that's available. So thank you for that, Jim. We appreciate it.
Yeah, we do that. And thank you for that comment, Elise, because we try to do that. When we're working with different types of organizations and they're a grantee, they come to us, they talk to us, and they're looking for solutions. And we have people in our office that are willing to connect the dots. And we want to connect the dots because at the end of the day, we're trying to look at evidence-based solutions to address, pediatric mental health in the UP. And we have to do that. We
Yep.
have to. They're our future.
Yeah, thank you. I want to take a minute just to thank all of our panelists tonight. This has been an excellent conversation. My hope is that if people are unable to join us live tonight, that they will be able to at least view the show on our website, nmu.edu/rural health, and it's under UP Community Health Town Hall Series. Christy Heckman, Greg Nean, Darren Kinnanen, and Jim LaJoy, thank you once again. We really appreciate having you on tonight, and my hope is everybody will plow forward, in addressing these issues. And I look forward to having everybody come back on and talk about progress that's been made in the future. So I hope all of you have a wonderful Memorial Day weekend, and I look forward to staying in touch with all of you. So
Thank you.
Thank you.
you.
thank you.